So yes, my name's Melissa, as Claire said. I'm the Interim Chief Science Strategy Officer at HDR UK. So I just recently stepped into this role, which was previously inhabited by Ros Walker, who will be known to many of you because she was at MRC for I think over 10 years before she joined HDR UK. So that's me, Melissa. So I'm going to speak to you today about Health Data Research UK, the UK's National Institute for Health Data Research, and also the role of health data and the role that HDR UK has played so far in the UK's response to COVID-19. So I'll spend about half my time talking about introducing HDR UK and sort of what we've done so far, and then the other half talking about COVID-19 a bit more specifically. So Health Data Research UK. So our mission is to unite the UK's health data, and there are many incredible health data assets across the UK, to enable discoveries that improve people's lives. That's it in a nutshell. Our 20-year vision is for large-scale data, big data, whatever you want to call it, and advanced analytics to benefit every patient interaction, every clinical trial, to enable biomedical discoveries and to enhance public health. So we are funded, our principal funder is the MRC, thank you MRC, and MRC alongside EPSEC, ESRC, UKRI, Wellcome Trust, BHF, NIHR and the equivalent organisations in the other devolved nations. So a whole football team of core funders. So we are a truly four-nation institute. So originally we were set up on 6 sites across the UK. So we have a site in Scotland, HDR UK Scotland, a joint site between Wales and Northern Ireland, and then 4 sites in England. So a London site, Midland site, and Oxford and Cambridge. And most of those sites are collaborations between a number of different universities and organisations. We've then since added two other sites in HDR UK North and HDR UK Southwest, as well as our health data research hubs, which are distributed across the UK, which I'll say a little bit more about later. I'll also say a little bit more about our Masters and PhD programmes, and those training locations, again, are spread across the 4 nations. And our central coordinating office is in London, so we sit in the Wellcome Trust. Well, we normally sit in the Wellcome Trust. At the moment, we're sitting all over the place at home. And we also have a second office in the Great Ormond Street Drive unit. So that's us. So we're on 86 organisations who are now involved in HDR UK and 56 offices across the UK. So we're really truly nationwide. So as well as being truly nationwide, we're also a cross-sectoral organisation. So we're not just a group of academics. We're academics, researchers, technologists, clinicians, patients and the public, and across all sectors. So industry, National Health Service, academia and charities all working together. And here are a few snapshots of our HDR UK community at various different events, which all occurred clearly prior to COVID-19. It's quite disconcerting to see everybody sitting so close together these days, isn't it? So our strategy has got 3 main strands. So, and it's all of the things that we do to health data, essentially. So we unite health data, we improve health data, and we use health data. So I'll tell you a bit more about each of those in the next few slides. But just to point out that public, patients and practitioners, so public trust is really at the heart of everything that we do. We have a really vibrant public advisory board and a public and patient network who get involved in all sorts of activities across the board at HDR UK and really help to sort of shape our agenda and the way that we do things. Also just wanted to point out sort of bottom left, our One Institute values. So transparency, optimism, respect, courage and humility. So, you know, most organisations have values, but I must say that of all of the places that I've sort of have experience of, I think HDR UK really channels and really lives those values more than any other organisation that I've come across. And I'll try to remember to pick up on various aspects through this presentation where those values are really sort of lived in the work that we do every day. So I shall tell you a bit more about each of those 3 areas, the uniting, improving and using health data. So first of all, in terms of uniting health data. So we have brought together the UK's major health data custodians. So those organisations who collect and sort of look after NHS data, so data collected as part of routine health and social care. Data that's been generated specifically for research, so for example, cohort data, as well as other sorts of data like registry data and trials data. So we've brought those organisations, those custodians together in a group called the UK Health Data Research Alliance. And we work really closely with them in terms of sharing best practice across them all, and also with the aim of making the data that they hold available through our gateway, the Health Data Research Innovation Gateway. So just to point out here, I think it's important to point out what we are not as well as what we are. So I already mentioned that we're not just an academic research institution. We have our members embedded within, as I say, NHS, industry, and so on. And another thing that we are not is we are not a data custodian. So we convene the UK's national and local data custodians, but we're not a data custodian ourselves. So the gateway, so the Health Data Research Innovation Gateway. So this is a portal through which researchers, wherever they are, can find and access nationally aggregated and data which is usable for research. So researchers can discover data through this portal. It's de-identified. In many cases, it's linked. Linkages are made between data sets. And then from the gateway, they can then make data access requests to the custodians who look after that information. So we're linked to trusted research environments, TREs, if that's a phrase that's familiar to you. But again, we're not a trusted research environment ourselves, so we don't actually sort of host the data itself on the gateway. But it's sort of like in a way, a shop window, a sort of one-stop shop for researchers to come and to find out what data we have, what health data assets we have in the UK in order to then identify data sets that can be used for research. And we'll talk a little bit more about the use of that data in a moment. But this is what the gateway looks like. So it's quite user-friendly. And as you can see, I don't know if you can see my mouse moving on the screen, but we have now at the moment over 500 data sets are on the gateway. And also 143 tools. So although the gateway was principally set up for as a portal for health data research data sets, we also host tools, so digital tools to improve and to analyze health data. Also publications, so publications in which insights have been generated as a result of using health data. And also a number of courses, and this will really develop over the next year actually. So courses that researchers and others can take in order to sort of upskill themselves in terms of health data research analysis, but also to learn more about other aspects of using health data, such as the information governance surrounding various different health data sets and so on. So that is the gateway. So that was uniting. So the Alliance and the Gateway are our main activities around uniting the UK's health data assets for research. And then this slide is really around improving. So we have set up, so as well as uniting data, we also aim to improve it. And by improve, we mean sort of making it, well, better quality, but also making it more research ready, because the data sets that have been created for use in research are obviously already research ready because they've been created with that in mind from the off. But for example, electronic health records, so health data that's been collected as part of routine health and social care, it's been collected for the purposes of care rather than for the purposes of research. So there's quite a bit of work to be done there. It's such an incredibly rich resource of information to use that can be used for research. But there's some work that needs to be done in order to make that really maximally useful for research in terms of improving people's lives. So we've set up a number of hubs, health data research hubs, and the purpose of those is to improve the data and also offer services to researchers who want to use data but perhaps could do with some sort of expert support, professional services in terms of knowing how best to use the data. So some of our hubs, so again these are spread across the UK, and they're collaborations between academia, industry, and in many cases charitable organisations as well, with a really strong public and patient involvement and engagement aspect as well. So some of our hubs are disease specific, like Breathe, for example, is a health data research hub for respiratory conditions. And then others are sort of disease agnostic, so not disease specific, like NHS DigiTrials, for example, which aims to support researchers in running sort of 21st century data enabled, big data enabled trials. So that's our portfolio of hubs. And so the third element of our strategy was using. So we've done uniting and improving so far. So now using. So we have 4. So the bottom 4, the blue boxes there. We have 4 vibrant areas of health data research programs that various projects and activities underway underneath each of those 4 around using health data to better understand the causes of disease, so a kind of molecules to health record approach to understanding the causes of disease, better, faster, more efficient clinical trials, so using, you know, really sort of cutting edge and data enabled approaches to almost sort of democratize clinical trials to make them more nationally inclusive, and so on through linkage to electronic health records. And then we want to understand cause of disease and enable better clinical trials, essentially to either improve public health or improve care. So our better care national priority is sort of really at the interface between health data research and the NHS specifically. And then underpinning those 4 areas of using health data, our national priorities in using health data, we have the human phenome and applied analytics national priorities, and they are concerned with developing tools and methods to enhance and sort of maximize the use of health data for those reasons. So those are the 3 different areas of our, 3 different areas of our strategy. So now the text on this slide has got somewhat small. I've been using this slide for quite a while now, a couple of years. It's a timeline of some of the major milestones that we've enjoyed at HDR UK over since we started in well, I think the quinquennium stopwatch started in April 2018. So we're about just over halfway through our first quinquennium now. But I think the lifetime of this slide is now expiring because there's so much packed into it that actually the text is getting too small to read. So we might have to think of another way to display this. But I think it just goes to show how incredibly busy and how fast paced things are at HDR UK. And all of the fantastic achievements, as I say, that we've enjoyed. So I'll just pick out a couple. So yeah, just to say that we sort of started in earnest in April 2018. Prior to that, Andrew Morris was announced as our director, which I must say is one of the reasons I joined HDR UK. Andrew was a really inspiring and collaborative leader, and the sort of leadership, top of the leadership team between himself and Caroline Cake is, you know, really exceptional in terms of the leadership that they provide for us. A couple of other things to pick out are when our gateway was the sort of first minimal viable product was released in terms of our gateway. So that started not even a year ago, actually. The 7 hubs were launched in September 2019. I mentioned those earlier. And NHS Digital became a founding partner of our UK Health Data Research Alliance that I mentioned earlier in 2018. And I think we have over 40 data custodians involved in the alliance. So that's just to sort of give you a feel for the pace of work and the various different milestones that we've passed so far in HDR UK. So now I'll switch over to COVID-19 and our response and some of the key insights that have come about as a result of our work on COVID-19. So like many others, as the pandemic sort of emerged, we identified what we thought are the 3 key priorities for HDR UK, the role that we could play in the fight against COVID-19. So 1, we play a coordination and a kind of connection role across the UK in terms of national data science driven research efforts related to COVID-19. So, you know, so the whole of the research community across the UK, you know, I'm sure we've all seen sort of pivoted towards COVID-19. And there was a lot of there was risk of sort of fragmentation and things not being joined up. And so we've played quite a strong role in terms of coordinating and just making sure that everyone is sort of in the loop in terms of data science driven, specifically research efforts related to COVID-19. I'll say a bit more about that in a moment. So a second priority was to accelerate access to UK-wide priority data, which is relevant to COVID-19. And again, I'll say a bit more about that in a moment. And then third was to leverage the best of the UK's health data science capability in order to address the wider impact of COVID-19, so the indirect effect of COVID-19, and in particular the vulnerable groups that would be hardest hit. So we support the UK government response through regular reporting to SAGE. So at first we were reporting on a weekly basis and now fortnightly. And as soon as we send our reports to SAGE, we also publish them on our website. So that's one example of channeling that transparency value that I mentioned earlier in terms of our One Institute values. And they're a really good read. So I would really recommend that you look them up. Because yeah, they're really a fascinating read. I'll show you an example in a moment, actually. So large-scale collaboration for us is really essential for achieving large-scale results. So I mentioned that we play a kind of coordination role, bringing people together and sort of sharing information in terms of what health data research initiatives are underway in COVID-19. So we've held 25 task force calls. We bring together the health data research leads from across the UK. As I say, it was weekly and now fortnightly to kind of share information and keep each other up to date with what's going on with the COVID-19 health data enabled research. And we've engaged over 150 of research leaders in that to date. And I can't think that there are many who haven't been involved in those calls and those initiatives. We've now published over 1,000 COVID-19 preprints and peer-reviewed publications. Yeah, so large-scale collaboration, the first priority that I mentioned before, really, really important. Another role that we've played is around prioritization of research questions in COVID-19. So don't worry too much about the detail of this slide, but this is just to demonstrate that we had a really robust process for that. When COVID-19 hit, there were so many ideas about which research questions were the most important to ask about COVID-19, you know, around transmission and immunity. And those research questions came in to us from members of the public, from clinicians who are at the front line, who are observing things like, you know, for example, that perhaps seeing more people from BAME backgrounds being hospitalized as a result of COVID-19, questions for researchers, and so questions from everywhere. So we played quite an important part in kind of funneling those questions into a process, and we employed a sort of urgent COVID-19 review group from our senior sort of research directors and others and hub directors involved in the HDR UK community, and we prioritized those research questions. So I think in the end we looked at sort of over 100 research questions and prioritized them according to unmet medical need, that was a really helpful process, I think, for many funders and many others engaged in research. So this is an example of one of our SAGE reports, which, as I say, is really well worth a read. So there's always one slide in there that has some of the latest insights from the last couple of weeks, and I'll just pick out a quick example, which is around, there was a research question looking at whether living with children either sort of protected you from COVID-19 in terms of immunity or actually put you more at risk. In terms of, you know, the hypothesis of children perhaps being super spreaders. And the answer to that, in this study at least, and they looked at 10 million adults, was that there was no evidence of increased risk of severe COVID if you live with children. So that's a relief for many of us. And then a really important slide in that SAGE report that we put together every couple of weeks is the availability of data sets. So I wish I could show you a sort of a time lapse of how this slide has changed over the year. Or sort of, you know, 9 months or so. So it started off as very kind of white and blue in that, you know, the data sets weren't available for, lots of the data sets weren't really available for research. And over time, this slide has become kind of more green and then dark green as those data sets have become available and accessible through the gateway, through our health data research gateway that I mentioned earlier. So all sorts of data sets relevant to conducting research on COVID-19. So we're now, so we no longer prioritize COVID-19 questions, because the government recently, about 6 weeks ago or so, has announced a number of national core studies, which are based on sort of the most pressing research questions that we now need at this point in the pandemic. So surveillance and epidemiology, so longitudinal health and well-being, so long-term health of people who have had COVID-19, clinical trials, transmission, environment, and immunity. And the underpinning project, which HDR UK is leading here, is around data and connectivity and making UK-wide health and administrative data available for linkage and accessible for researchers, for all of those researchers who are involved in the national core studies in blue there above, but not just available for them, but available for all researchers who are looking into COVID-19. So we're playing a really pivotal role sort of going forward over the winter to cope with COVID-19 over the winter. And tracking the effectiveness of vaccines will be a really important part of that as well. So again, that just emphasizes the importance of linking to electronic health records to be able to have that kind of long-term and national link into health data. So just to mention, I think I'm running out of time, so just to mention a couple of insights that have been generated by HDR UK researchers. So in understanding causes of disease, so one of our fellows is actually leading project manager for COG UK, so has responsibility for overall coordination of COG UK, which is a national project, which is sequencing the viral genomes of as many COVID-19 SARS-CoV-2 strains as possible, and they were able to identify that actually the UK had about 40 strains that came in sort of originally in the first wave, and actually very, very, very few of those were from Asia and China, and actually the majority of them came from Europe, so that was really interesting. Clinical trials, so Martin Landre is our research director for clinical trials, our clinical trials national priority, and has been leading the recovery trial, which found that dexamethasone reduces death for hospitalized patients with severe COVID-19. So we did a PR campaign to kind of let people know about some of the major insights that health data enabled in terms of COVID-19. So this is a sort of an array of the various insights that came through from the HDR UK community, which you'll be able to find on our website and on Twitter and so on. And we've learned some really important lessons through COVID-19, which are not necessarily surprising, but actually COVID-19 has really hammered home these messages in that data is a key resource to help save lives. Lesson 2, getting value from data really requires people working with a range of skills together. So in that interdisciplinary community is really important, and that the public and patients are not only enablers and also really important advocates for the use of health data for these reasons. Our work in COVID-19 has really been an exemplar in terms of the importance and the value that working with the public, that sort of involvement and engagement with the public really brings. And it's just a couple of quotes and other measures of how engaged we've been with the public in this. So 16,500 contacts with patient and public contributors across the Institute this year. And then, so just really quickly to end, just to give you a taster of the international flavour of what we're doing as well. So so far I've been talking about kind of the UK focus of our work, but we also are convening an international COVID-19 data alliance. So similar to our UK alliance, but in international flavour, COVID specific, and with a focus on low and middle income countries. And there's more information on our website if you want to know more about that. And I think I've gone slightly over time, so I'll stop there. But just to say that we've recently put together a couple of animations to explain what the gateway does, and also to talk a little bit about dataset utility and standards. And they're really good. They're very accessible, and I would really recommend you have a look at those animations to kind of learn a little bit more about what we're doing there. And that's it. That's me. So thanks for listening, everybody.